So, welcome back to another lesson where we'll be discussing semaglutide and MIC. In today's lesson, I want to share with you when you should choose MIC over semaglutide and when do I combine them. I do something differently. Yes, I know you're going to be saying, well, Dr. Genty, you've been talking about how toxic semaglutide is, GLP-1 is. They are. I am not completely 100% against conventional medicine. I use conventional medicine treatments to stabilize my patients, to help them reach their goals faster, but I use them for a short period of time. For instance, if you come to me with diabetes and your hemoglobin A1C is at 13, your insulin is 54, and then your glucose is 400, I might use some conventional medicine treatment to decrease those numbers as we are allowing the natural functional medicine treatments to take place. If you come to me with shingles, I might prescribe Valtrex. I'm going to prescribe some prednisone because we want to decrease the stress on the body so that your cells can get a little breathing room to work for them, to give them a break, so to speak. So when it comes to combining semaglutide with MIC B12 plus, I have a different strategies, how I use them. And we're going to go over that first. So if you don't know what I'm talking about, what is MIC B12 and what is semaglutide, you can either Google them or you can watch the previous videos that are on this topic, because we introduced this product into our clinic as a new treatment, new services, and we have a special promotion running until March 7th. The time I'm recording this is still the first week of March. Natural weight loss injections with 6+ ingredients in the syringe that will help you see results, improvement quicker and faster without the side effects. This product is for you. It's $45 per injection until March 7th. After March 7th, the price goes up to $65, which is still reasonable, which is still cost effective and aka cheap, because we put a lot in the syringes, and I studied every single supplement and I found the company that has the best, potent, preservative-free, toxic-free ingredients, and then we inject that into your muscles, which increases the absorption rate, and then with 10, all the way up to 10, 4, 6, depending on the individual, and whatever else you're doing at home, you're gonna see results. So I discussed in previous videos the mode of mechanism or the mode of action for these injections, with the fat loss, weight loss, appetite control, mood elevations. What else? It helps with cholesterol as well, like manage your cholesterol, helps with hormones, the insulin sensitivity, helps with adrenals and thyroid hormones. I mean, you can watch the other videos. They are so energy. Oh my God, energy. And reducing brain fog. There are so many benefits to these natural weight loss injections. And I'm also aware that you can go to any bar, IV drip, IV lounge, and get MIC B12. But what's different about ours is that not only I studied, it took me 3 months to find a company that like literally caters to functional medicine, meaning that looking at the way they process the products and also decreasing the toxicity level. Because as a functional medicine doctor, natural medicine doctor, holistic medicine doctor, my goal is not to inject toxins into your body, because toxins lead to inflammation, and that's how you have all these conditions, diseases out there. So if you're interested, you're like, oh my God, this sounds good to me, I can drive to your clinic. We are located here in Denver, New Jersey. Feel free to come in and get the injections. It is the best cost-effective ways of losing weight and also seeing the improvement, feeling amazing, have energy. But when you lose the weight, you're losing fat, not muscle, comparing to the GLP-1. So let's go over, when do we choose MIC B12 and when do we choose semaglutide? All right, you ready? I'm going to share my screen. I wrote everything down. I'm going to share with you, we call it lessons, so that you can see it, you can hear it, and you can go back to this video and watch this lesson over and over again. All right, here we are. Now, when do we choose MIC B12? Anytime you want to lose weight. If you're not happy with the way you feel in your body, you're not happy with the way you look, you're like, I'm doing all of the things. I have a personal trainer, I'm working out, I'm eating healthy, but the weight is not budging. It's all natural. It's 100% natural. There's no toxic pharmaceutical products in here. Like, I'm not giving you chemicals. It's natural. It's B vitamins. It's things that you can get as a supplement. We put it in a higher format, like a different form, higher potency in a syringe, and that's what you're getting. If you're looking for a natural, sustainable weight loss solution, where you don't have to depend on the injections for the rest of your life, Make B12 is yours. If you're looking for energy, you're looking to eliminate your brain fog, you want to feel good in your body and have that stamina, Make B12 is for you. If you're looking for a way to control your cravings, Make B12 is for you. If you're looking for a way to cater to your liver, give your liver some TLC, reducing toxic buildup, Make B12 is for you. If you're looking to decrease some of your diabetic markers, hemoglobin A1C, Make B12 is for you. Now, disclaimer, I am not your doctor. I have to say this. I am not your doctor. I'm only giving you information. I'm sharing information. Please take everything back to your doctor. But if you're looking for a functional medicine doctor, I would love to help you identify the root causes and create a protocol, a plan for you that will help you get results. That's what functional medicine is to help you restore the function of your body. Now, if you are going to use MIG-B12, I want to be very transparent with you because I don't want you to have the wrong intention that you can just take this injection and do nothing else. No, you have to do a lot of other things. You have to focus on your diet. You have to focus on moving your body. You have to focus on your stress management. But taking this injection can help these things, can help you do these things with ease. I'm not going to focus on my dietary piece if I'm tired all of the time. I'm not going to focus on meal prepping if I can even get up and just cook the food. I want conveniency. I want to put something in my body and keep moving. So if you do this, the B12, we also add in B12, B1, and B6 in the injections. That's gonna serve you. We are recommending 1 to 2 times per week. Twice is better because you are loading your cells with the vitamins. Protein intake, you gotta increase protein. Now, depending on you and your individual, your age group, and your composition, work with your doctor in identifying how many grams of protein. Start with 0.5 gram of protein per weight. So if you weigh 120, divided by 2. So that's how you start, and then take it from there. So now with the protein intake, you can increase your protein shakes. I give my patients recommendations. You can eat more lean protein. Like there's so many ways you can get protein. If you're vegan, vegetarian, you can get it from your beans. You can get it from so many other sources, but we want to focus on protein intake. Why is that? Because it's going to enhance your muscle gain. We don't want to lose muscle. Not that you're going to lose muscle, but we want to keep the muscles that we have, but serve the muscle mass, the muscle fiber, so they can come out. Now, you do have to detox. When you detox, these injections will absorb better. The ingredients will absorb better because your cells are open, they are readily available, they are here to suck it all up. So I have my total body restoration program, which is the best detox program, where we address your lymphatic system, your liver, your kidneys, your skin, your gut is the best. But if you don't have access to a program like that, or you're not ready to make that investment, you can do Mictaso, dandelion tea. So these are some examples, but again, you have to work with your doctor in getting the right dosage. With the Total Body Restoration Program, everything is given to you, everything's included. And it's a 2-month program where you're working on removing toxins, improving the function of your body. Weight loss is also very noticeable in this program, but you feel amazing. I would advise that you do strength training, like go to the gym, lift some weight. If you can do 3 pounds, 3 pounds is better than no pounds. Do something, and then you have to stay hydrated. Because as you are removing fat from the liver, because MIG-B12 helps with fat reduction and prevent fat accumulation. So you want to make sure that your cells are hydrated, and you're also supporting your organs with electrolytes, sodium. I mean, the hydration piece with electrolytes should be like a given. Like we all need hydration and electrolytes in our body. So what can you expect with the MIG-B12? For us, it's 5 to 10 pounds in 3 months. But again, if you do other things, it's less than 3 months. This is very realistic here, but you can lose 10 pounds in 2 months. You can lose 10 pounds in 1 month without muscle loss. It's what are you willing to do? How far are you willing to go? What else are you willing to incorporate with this whole process? Increase energy and better moods for sure. And then improve digestion, liver function, and detox. You feel great. You feel amazing on this product. So this is when you should choose MIG-B12. If you like, I really want to live a toxic free or toxic less lifestyle, and I want to lose the weight, or you've tried all the other things, they're not working. Now, when should you choose semaglutide? I had to put that here. If you're looking for short-term weight loss, for instance, you are going to a wedding or you're getting married and you want to lose 20 pounds rapidly, which is not safe, you do semaglutide. But guess what? We have to be realistic, and the expectation is that whatever pounds you lose, you might get gain all of it back or half of it back. Just expect that. But it's for short-term fat loss, instant gratification. I'm willing to do whatever. And then when I lose the weight, or you can start the weight loss journey and then start incorporating other things to enhance it. But you have options. So rapid weight loss, short-term weight loss, people that have a BMI of 30, so that's some of my patients struggling with appetite control. If you have a hemoglobin A1C, insulin resistance or hemoglobin A1C more than 5.7, I would say if you have a 6.5 or higher, I would do that. Again, if you have food addiction. Now, the bad part about this, which all of us are aware of, are the side effects. The bad part is the side effects. Suppresses your appetite, like we need to eat. So this will lead to nutritional deficiencies, malabsorption, increased muscle loss, like you're gonna have flabby skin. You're gonna look older than your age. And then it's fixing underlying metabolic syndrome. So only works while taking it. Because once you stop taking it, all your underlying metabolic dysfunction issues will come back. So if you're gonna do semaglutide, work with your doctor. They're gonna start you with this low dose, and then you're gonna go up. Hopefully they are recommending 1 gram of protein per weight. Again, because you're losing more muscle weight here, so you need higher protein. Strength training 3 times per week. And then for many of my patients to maintain energy and metabolism, I highly, highly recommend MIG B12. Some doctors are doing that now. But the thing is, when they recommend MIG B12, the dosage is not the same. They're giving a lower dosage. So when you stop the semaglutide, you might gain the weight back because the MIG B12 dosage or the source might not be potent enough for you to continue with the weight loss. So what can you expect? Yeah, people lose 10 to 20 pounds of muscle loss, weight loss, but muscle, 2 to 6 months. Some people lose less than that. I have a patient right now, she only lost 5 pounds in 6 months. Major reduction appetite and cravings because it's tricking your brain in making it think that you're full when you're not. So now you're not producing enough hunger hormone, ghrelin. Reduction in appetite. So we need to eat. So whenever you're in a weight loss program that kind of reduces your appetite is never a good thing. Now you can have control over your cravings, but appetite, no, we need to eat. That's how metabolism starts. Potential muscle weight loss is definitely muscle weight loss. And then weight gain when stopping, definitely weight gain when you stop. All the weight is coming back, which is very frustrating as a human being. I don't know about you, but I'm like, I don't want to gain the weight back. So when do I combine MIG B12 and semaglutide? If I have a patient that's like 300 pounds and they are so uncomfortable, have you seen the show, The 600-Pound Life or something? Is it 600 or 300? But they are uncomfortable. The health is literally being affected by this weight. They are disabled. They can't get out of bed, or mobility is severely restricted. They can't move around. I would recommend semaglutide, but I do it differently than most people. So I will do semag for the first 12 weeks or 8 weeks, depending on the patient, as you can see here. But we also working on identifying the root causes. We're also working on the dietary piece. We're also working on the mindset. We're also working on the habits and behaviors at the same time. And I would give them a higher dose of MIG B12 so they can have that energy, because the larger you are, the larger your muscle mass and the fat cells are. We have to look at the composition of the human beings to make the proper recommendations for them. I am 110. I'm trying to gain weight. So the dosage for me might be different than someone that's 300. I would also focus the most on the dietary piece because we don't want them to lose muscle. I would give them a lower dose semaglutide and increase it slowly and keep them at 1.0 milligram per week. And then higher dose of MIG B12. And I would literally have them come in 2 to 3 times. We might do 2 ml, so depending on the individual, how much weight we want to lose and what the specifics are, the pre-existing conditions are. That's what I would do. And then for maintenance, I would literally do the MIG B12 for maintenance only. I will stop the semaglutide. We don't increase the semaglutide unless I increase it. This is a special case that I worked on to help a patient lose. That patient was really 400 pounds, like severely restricted. So we had to use some of this until we reached the body weight. And then we stopped the semaglutide and we proceeded with MIG B12. If you are not 400 pounds or your weight is not affecting your life, you can still move around, glutide might not be for you. I would not recommend semaglutide, even if it's 250, trust me. MIG B12, total body restoration, exercising, weight loss IV will do it for you. Dietary as well. I don't think it's necessary for everybody to take semaglutide if they have a lower BMI. BMI of 31 and 35. And I would also use this combination if people are interested in bariatric surgery. If you're one of those people like, I'm gonna get bariatric surgery, a lap band or shrink my stomach, I would do this because at the end of the day, those surgeries do not work. You gain the weight back, you can't eat enough, you're always full, you have dumping syndrome. So to prevent the side effects or the long-term adverse reactions of the surgeries, I would do this combination. But we are very specific, very strategic, no more than 12 weeks, which is 3 months really. That's 12 weeks. After 12 weeks, we stop because we don't want to increase more toxicity. After 12 weeks, I would also do another detox to get this thing out of people's body. So that is the only way I will use this product. Again, if you're watching this video like, oh wow, this sounds good, either call us, schedule an appointment, or take this information back to your doctor. Weight loss is so possible for you if you're willing to work with a doctor who knows what they're doing, and they can hold your hands and support you psychologically, emotionally, and physically along the way. Not just give you a whole bunch of pills, a whole bunch of supplements, a whole bunch of injections, and then goodbye. Doesn't work that way. That's why so many of us fail. So many of us do not continue on this journey because we feel we're exhausted, we are depressed, we like, oh my God, I'm giving up, so this thing's not working, and you're paying $1,000 per month. Semaglutide is very expensive. You think $45 for Make B12 is, promotion is good? It's not expensive. Try semaglutide. Insurance are denying, they're not covering. So is it worth spending $1,000 on something that might not work? When you can literally try the natural route first, work with your doctor, incorporating some of that pharmaceutical piece so that you can see the weight. All right. So if you have any questions, you desire to work with somebody like myself and you like the content that I'm putting out and you're sharing it with all the people, I would love for you to leave us a comment below. If you are interested in identifying the root causes of your health issues, whether it's fatigue, brain fog, stomach issues, you see all the links in the comment section below. If you're interested in any of our services, the total body restoration, you can do anywhere in the States. It doesn't have to be here in New Jersey, it can be anywhere. Please reach out. We'll, talk. We'll share the link. We'll, ship your products. If weight loss injection is something that's interested of yours, yeah, let's start the conversation. So this is the lessons I have for you. Hopefully a thing or two that I mentioned here resonate with you. Until then, I'll see you in the next lesson. Bye.